Good evening and welcome to the Arabic channel. This is Suad Asfour, your host. I have a special announcement to make today. Important announcement for the Moroccan community. There will be a fashion show and gala Moroccan dinner on Saturday, August the 20th, 2016 at 7 p.m. Kaftan du Morocco in Los Angeles. Music by Bay Area stars Sammy and Eunice. For more information, please call Simo at 831-402-8176 or Asma at 502-889-8539. Book your tickets now to attend Kaftan du Morocco in Long Beach, Los Angeles, California. Thank you. And now it's time for you to introduce to you my very special guest for this evening. I have with me in the studio tonight Dr. Hani Jamah. Hani is a dentist and implant specialist. Graduated from USC School of Dentistry in California. He is a doctor of dental surgery in San Jose, California. Dr. Jamah is devoted to restoring and enhancing the natural beauty of your smile and believes that every patient deserves to have a healthy and beautiful smile. He is here today to educate us on how to maintain healthy teeth and how to stay aware of your dental needs. Welcome to the show, Hani. Thank you for coming.
Thank you, Suad. Welcome. Appreciate it.
Thank you, doctor. It's really nice to have you on the show.
I'm honored.
Can you give us a little bit about yourself, first of all? Where were you born and where are you from?
Okay, well, first of all, thank you very much for having me here. I'm very honored to be in your show. And to all the Muslims and Arab community, I wish them Ramadan Kareem and happy Ramadan, Ramadan Mubarak. Well, first of all, where to start?
Where were you born? Let's start with that.
Yes, well, I am Palestinian. My parents are Palestinians, and I consider myself Palestinian as well. Mm-hmm. I was born in Saudi Arabia, in Riyadh, and we are originally from Gaza in Palestine. And I grew up in Saudi Arabia, and I had the chance, and I was so lucky, actually, to go to pursue my education in India.
Wow.
Yes, in the early 80s.
So what made you go to India, for example?
Well, Palestinians are considered refugees in the Arab world, and we didn't have much opportunities as the people of their countries, as citizens. And so if you have 95% or 98% in your high school, 4.0 GPA, you have no chance to get to your school of dream. So to become a doctor or a dentist or a physician, or if you want to be an engineer, you cannot. So you have to go and shop for the program that you like overseas. And here I am in India. Some Palestinians went to people who can afford it came to the United States because they have to go on their own, and some people have to go to Philippines, and they have to go to Indonesia, Malaysia, other countries. Yeah. Mm-hmm. So it happens for me to be India, and I was very, very blessed to be there.
Okay, so your ancestry are Palestinian, your mom and dad, but you never lived in Palestine?
Never. I just used to go there to visit.
Okay.
Yes.
And you spent all your life in Saudi Arabia, then you moved to India?
India,
How
yes.
long you were in India?
Almost 6 years.
Oh, that's interesting.
Yes.
And what made you come to United States?
Well, I had a scholarship. I was blessed to have a scholarship from the United Nations. I was selected to be in a brilliant student program for the United Nations. And that program covered me for both India and the United States. Mm-hmm. So I was here. I came in my 20s. and I was here since then.
So are you completely done with all your education?
I'm
For
never
the-
done with my education.
Never, no.
I have a class. I have a class
Coming
next
up.
week. So every month I have about 10, 15 hours of education.
Continuing.
Yes, absolutely.
Okay, that's great. So tell us, doctor, what you provide, what you specialize with?
Right. Well, I'm a dentist by profession. I'm a general dentist, but my area of expertise that I think I can enjoy doing the most is basically implant dentistry. I do a lot of oral surgeries, wisdom teeth, crown and bridges. I mean, in general, it's general dentistry, but my area of interest is mainly implant and oral surgery, with crowns and bridges highlight as well.
Okay, so tell me the difference between the implants and the crown and all these other things that people need every once in a while.
Right. Well, dental implant is not that everybody may need. Dental implant is an ideal replacement of a missing tooth. If somebody loses his teeth because of a gum problem, 80% of people lose their teeth not because of cavities, it's because of gum diseases. So it's sad that somebody lose his teeth and have no replacement. It has a huge impact on his social life. It's an investment. If somebody loses his teeth, he cannot find a good job. He will hide from people because he's hiding his or her smile. So that's going to hide them away from having a great opportunity to have a good job or a good business. So I believe when you provide a replacement of their teeth in a healthy, natural, affordable way, by having either an implant or a bridge or a crown or whatever the patient need, it's a way of enhancing that person's quality of life, and also it's a return of investment as well.
Beside the quality of life, does it affect our digestive system?
Absolutely. They had a research where they had a healthy dog with full teeth, and they pulled that dog's teeth, and in few days that dog died. He could not manage to survive.
Oh, wow.
We human, we are kind of some form of animal somehow. People might disagree with me to a certain point, but we add more the social and psychological dimension to it. When we lose teeth or even a tooth, it has its impact. The main impact is our own health. When somebody cannot chew his food, he will get frustrated in his chewing ability and he will swallow the food, half digested. So what happened? The stomach is not ready.
Oh, that's what happened.
The stomach is not ready to digest a solid food. So the stomach will get somehow, I would say, frustrated in the digestion process, taking a long time. So the stomach will tend to absorb the food undigested.
Wow.
And this will end up with, number one, obesity. People, if you have noticed, people without teeth, if you have noticed, many of them are actually obese.
Because they swallow the food.
They swallow the food. They tend to have a quick nourishment in the form of sugar, sweet, fat, maybe like soft bread, carbohydrate, fat. What this will lead to? It will lead to obesity and early death, hypertension, and also depression.
Okay, so to have a full set of teeth and healthy teeth is very important.
Here you go. That's
What about bad breath? Is it
Right.
How important that goes along with the full set?
Right. Well, many people are concerned about bad breath. They even try to shy away when they talk. Well, bad breath is natural to a certain degree. When you wake up in the morning from a long sleep, okay, it's natural to have a bad breath. Why? Because there's a less salivation, there's less flow of saliva. And whenever there is less saliva, there's less antibodies in the mouth, and this leads to dryness of mouth and bad breath. So that is natural. Once you wake up, you have a breakfast, you brush your teeth, boom, you're back to normal, a fresh breath kind of sort of thing. What we are concerned about is when people have a bad breath as a result of a gum disease, decay or caries, or systemic problems. Here we have to talk about it. But from my perspective as a dentist, I'm mainly focused about bad breath because of because of gum disease. That's why I highly recommend everybody to see his dentist every 3 to 6 months, at least for checkup and cleaning. As we change oil in the car every 3,000 to 5,000 miles, we have to see a dentist every certain amount of time. The recommendation is twice a year, every 6 months. Something I would like to highlight here, anything we use daily need maintenance. If you drive your car daily, you need to have a daily maintenance. You have to look at the gauges, the temperature, make sure you have enough oil here, you have enough water there. And on a monthly or annually, we have to do the checkup, the 50,000 mile service, and what have you. Same thing with us with our teeth. We have to make sure that we have a daily checkup. We brush our teeth, we make sure our gum is okay, and every 6 months we have to do a 5,000 mile service, if you will, okay, in the form of a checkup and dental cleaning. This is the way I recommend for everybody. Otherwise, we're going to end up with more complications, unexpected issues with teeth, broken teeth, severe pain that's unexpected.
And dental flossing also is very important.
Right. So thank you for mentioning that, by the way. The daily maintenance, I would say, is basically 2 major daily maintenance, okay? I like cars, so maybe this is the term I use, daily maintenance, okay? Number 1 is flossing. Flossing is extremely, extremely important. If you brush 20 times a day, it's not enough without flossing.
Okay.
All right. Flossing is extremely important because you're actually removing the bacteria and the food residues between the teeth that a brush cannot get to.
Yes.
That food is responsible for the bad breath, gum inflammation, and subsequently teeth loss.
And also the circulation of the blood.
Exactly. So when you floss, actually, you're not only cleaning, it's a mechanical cleaning, it's also a massage that takes place to the gum, so more blood circulation. And once you end up flossing, you go ahead and you brush your teeth. So it goes first flossing, and then you go brushing. Ideally, I would recommend it every night, and brushing minimum, I would say, twice a day. If you want to do it after lunch, that's actually great. That'd be a wonderful thing to do.
That's good. That's very understandable.
Right.
What about snoring? Is it related to healthy teeth, or it has nothing to do with it?
Snoring is it's a problem. It's a problem. It's usually associated with there are many factors with snoring. Mainly obesity, weight gain, leads to snoring. When somebody gains weight, there is more deposits of fat tissues between the throat and the skin outside in the neck, and this compresses the airway, leading to snoring at night.
Okay.
This is in a simple way. Now, some people sometimes with the wrong pillow position might end up snoring. Sometimes it's natural after a long, tiring day. Some people tend to snore a little bit, okay? But overall, it's mainly associated with issues with weight gain.
And maybe some medication to sometimes make
I
people
believe so.
snore.
I believe so, yes.
Okay, let's talk about braces. How important to have braces when needed, even though if the quality of the teeth are not very strong?
Right. Well, we have to understand why we go for braces. People go for braces for 2 reasons. Either aesthetic, they want to look good, or function, they want to be able to eat well. Okay, so it depends on what's the intention behind having the braces. Now braces have advanced so far in technology in our era to the point where there is even no need to have metal braces or the conventional braces. There is clear braces, like Invisalign, for example, clear braces or Invisalign, just an example. I think it's important, depends on how you want it to be. If it's function, then here you go.
You have to have it.
You have to have it. Aesthetic, cosmetic reasons, if somebody's happy with his smile, why braces? Okay. Now, if people or a patient had severe crooked teeth or misaligned teeth, here we recommend braces, even though he has a good function. Because when the teeth are misaligned or crooked, they are food trap, and food trap means cavities and teeth loss.
Wow, that's interesting. What about the clear braces you talked about? Does that hurt the same way like the metal kind?
Right. Well, the term hurt is something rational. It's a relative. Some people may find it hurt, some people may find it as a discomfort. I would say usually any kind of teeth movement will lead to a form of discomfort. When you push a tooth from its location, there's a stress on the ligaments, there's stress on the neighboring adjacent teeth and bone, and that causes a form of pain or discomfort. I think it's a healthy pain, it's a good pain, and I wouldn't call it pain, I would call it more of a discomfort.
Discomfort.
But eventually it will go away once that period of tightness is resolved.
Yeah, and it'll be worth it at the end.
It's worth it with a beautiful smile.
Doctor, what about the root canal? What do we do to our teeth to get to the level where we need the root canal job?
Well, the best thing in relation to a root canal is to avoid root canals. Okay, root canals is a situation when a cavity invades the tooth nerve, and the only solution is to basically pull the nerve along with the blood vessels. That's called a root canal treatment. It is the treatment of choice when the cavity is huge and causing an irreversible pain. We call this irreversible pulpitis. Okay. Now, I'm sorry, your question is how to avoid root canals?
Yeah, what should we do how do we maintain healthy teeth so we will never need a root canal?
That's a good question. As I mentioned earlier, the daily maintenance, the brushing and flossing, and the biannual or semi-annual, I would say twice a year of visiting your dentist and cleaning it. When the cavity is small, it's easy to remove, it's not painful, and it's cheap to remove, it's inexpensive. When the cavity is bigger, it's more expensive, it's painful, and it's not fun to end up with a root canal. So it's good to go to a dentist and see him for half an hour than getting a root canal at the end.
Okay, what about, how do you have any special remedies that we can do to avoid the ulcers and the swollen and, all these flushes that grows in the gum?
Right.
Something that would really be avoidable
Right.
from happening.
Right.
Some remedies can we use at the house without going to the dentist?
Right. Well, as we speak, I have one in my lip right now. I have one of these ulcers. Okay.
And you're a dentist, huh?
Well, yeah, I'm a human. I get it.
So it happens to everybody.
To everybody. Well, first of all, these ulcers, again, it depends. There's many categories, but I think the one you're talking about is called the aphthous ulcer.
Yeah.
It's a white. It's annoying. It's painful. It's just not fun to have. This one, usually it's resolved by itself. It takes between 5 days to 10 days to go away. So I wouldn't really bother much about looking for medication. Just try to avoid any irritation around, like avoid spicy food, avoid very hot beverages. Try to try to keep the area nice and clean and try to make it undisturbed. It will go away. Now, if somebody's in severe pain, I would recommend just Advil, aspirin, any kind of oral pain medication. Locally, somebody can use oral gel. There's some topical anesthetic you can apply. It will kind of take some of the pain away, but it will not resolve it. It will take its own course to go away.
Usually my homemade remedy is just gargle with salt and warm water.
This is the best magical treatment. I tell my patients, don't use any alcoholic base, don't use any other big brand name mouthwashes. Warm and salt water does wonder, okay? And it's available, it's inexpensive, and it's simple to use. Yes.
Great, thank you, doctor.
Yes.
What kind of difficult experience you had with patients throughout the years, something you've been through, and what's the worst experience that any dentist can have?
Right. Well, I'm sure you heard that the highest suicide rate is among dentists. I'm not sure you're aware of this.
No, this is the first time I hear it.
Well, yes, so it's based on some statistics and research. They found that dentists they are among the highest people who commit suicide.
Really?
Right, exactly.
So we stress you out that much?
Well, yes, dentists are stressed out because especially especially nowadays when you have there's so many things, so many. How can I say it? There's so many responsibilities, especially if you have your own dental office. Okay, you have some staff, you have some regulations, you have some laws. You have to, when you drill in a tooth, you have a high-speed drill with 600,000 rotation per minute, and you're cutting in a tooth the size of 8. It's the size of your thumbnail, and you have a tongue that's moving all the way, and you have all these nerves and saliva pooling, and you have a patient who could be scared. So any 3 millimeter, which is ahead of a pencil, okay, wrong direction could lead to catastrophe. So when a dentist is working in a patient's mouth, he is always under high tension, high stress level.
I can
Okay.
imagine that.
You see that? And this is from a simple filling. So what about doing an oral surgery? You're just in a close proximity from nerves and blood vessels, and then you have all these lawyers are waiting for you to make a mistake. Now, guess what? We are human. We make mistakes. We made mistakes. We will make mistakes. Okay? So when you are under this kind of stress and you work on a daily basis, that will get you. Okay? So seeing a lot of people, when you see somebody who tell you, I hate dentists. When you hear these negative things, even though you're trying to maintain a happy, positive smile every day, it will get you sooner or later. When I numb a patient, give him an injection, and I see that patient is in pain because of me, I'm causing pain for this person, it gets me as a dentist. So all these factors, when you accumulate these factors and pile them together, at the end of the day, it's a heavy weight on our shoulders. So dentist has to maintain high quality life in form of exercise, good happy relation with his family and friends, prayer, meditation, whatever you call it, could apply to that. But we certainly have this high stress level, and we try to work with it or around it.
I can imagine that. And that's why there's a lot of people that are always confused about which dentist they should use or go to. What do you say about how to find a good dentist? What do we look for when we go through, now the internet, dentists all over, and
Right.
how do we pick the right one?
Right. Very good question. I think you should go and interview your dentist. Okay. The first start with you can go online. I mean, nobody can use newspapers to look for a dentist anymore. So you can go online and see someone with high rating. I would say 3 stars and more on Google or Yelp. And then you can see the one that has reviews that make sense to you. And then you go there and interview your dentist. Talk to them, listen to them, look at the office, how hygienic is the office, how friendly are the staff are, okay? These all factors will help you to make a good decision of what dentist you can have for your future.
So what does it take on your side to increase the customer satisfaction? The patients, make them happier. What do you do on your own side, from your side?
Well, I always tend to take the extra mile. I will do the things that no other dentist could do. That's very difficult though. So for example, I make sure I open early at 7 a.m. for people who are early birds. At the same time, I want to stay late for people who work late. So I open at 7 a.m. on certain days, and other days I close at 9 p.m. So I'll be able to see and meet the satisfaction of these kind of patients. The other thing here is to do quality. People want quality. Okay, I'm a kind of a person who don't look for a cheap car. I look for a quality car. Not necessarily expensive, but a quality car. Quality sometimes comes with a price, right? So I make sure that every patient come to my office and get a crown, for example. I give them a 7 years warranty on each crown, or almost every crown I make. I only do 2 kinds of crowns, either gold crown or zirconia, which is the top crowns of the 21st century. Okay, and I give them 7 years warranty. Why? Because I know people want quality, and I want to attract only quality people who appreciate quality.
So quality in every profession,
Absolutely.
regardless. So you think the quality service is the key success?
Absolutely, absolutely.
Okay. With the last 3 minutes we have, I like to ask you to give an advice for everybody, whether they're, parents watching their children, or the elderly, or pregnant women, or everybody in general. What would you like to tell them so they maintain healthy teeth and healthy lifestyle?
Yes, thank you.
And they can have more dates.
Right. My recommendation, I acknowledge that everybody, no one likes to be stuck by a needle in his mouth. No one likes to have something hard to hit his teeth. However, it is important to follow what the ancient proverb we heard, that prevention is better than cure. الوقاية خير من العلاج. So prevention is inexpensive, it's cheap, it's available. So nothing like preventing a problem before it's happening. Toothache is very painful. Best thing to do is take care of your teeth, brush and floss, see your dentist once every 6 months, and I guarantee you will be very happy.
Okay, can you tell us about your location, so where we can find you? And people are
Yes.
watching now, and they're gonna say, "Oh, he sounds like he's a good dentist."
Well, thank you.
We got your phone number on the screen, and
you.
can you just tell us exactly where your location is?
Yes, I'm located in South San Jose on Blossom Hill by the Highway 85, and it's 5710 Cahalan Avenue.
And you said you specialize with implants.
I do a lot of, I'm not a specialist in implant oral surgery, but my niche is implant oral. So I do a lot of implant and oral surgery. I'm a general dentist, but I like to do, and I enjoy doing this the most.
And you also do root canal and
we
braces?
We do some root canals. I usually refer them out for root canals. We have a specialist who does braces, Dr. Hisham Amer. He's also my associate.
Okay, great. Thank you so much, Doctor. It's
you.
good to have you on the show.
Thank you, Suad.
And we're very proud of you.
Thank you so
Thank
much.
you so much.
I'm
And
honored. Thank
I
you.
wish you happy Ramadan,
Happy Ramadan.
and to all the Middle East people.
Ramadan Kareem. Thank you.
Okay, thank you. Thank you for watching. We'll see you next week.